Good day. Let's talk about what is an atrial fibrillation or AFib ablation procedure. An ablation is focused destruction of the abnormal misfiring electrical circuitry in the heart. It is a permanent method. The heart has 4 chambers. The 2 top chambers are the atria and the 2 bottom chambers are the ventricles. In atrial fibrillation, the misfiring comes from the top left chamber. So to perform an ablation, the doctor puts in intravenous lines or IV lines through your veins in the leg. Generally, both your groins or both your legs have IV lines put in, and we use this to travel from the legs to the abdomen up into the heart. And from there we enter the right chamber and cross over to the left chamber. Once we enter the left chamber, we ablate or destroy these areas by creating blocks or barriers around them, so we trap the electrical signals. So these signals can no longer communicate with the heart and cause atrial fibrillation. After we have done this, everything comes out after the procedure. This generally takes about 2 to 4 hours, and some patients may be offered the option of going home the same day. There are different ways to do an ablation. We can use heating or radiofrequency, cautery or bovie, which is the most common way of doing ablations. We can also freeze the tissue to destroy it. This is called cryoablation. We can use laser, ultrasound, and one emerging exciting technology is using electric field or pulse field ablation. It is very important to recognize that it takes about 3 months for the heart to heal from the ablation. During this time, atrial fibrillation may return, but it may sputter and die out on its own. We call this the blanking period, so we do not use this time to decide if the ablation was a success or not. So please don't worry if you have some return of atrial fibrillation in the first 3 months while your heart is healing from the procedure. This is a relatively safe procedure. Complications include bleeding in the groin, abdomen, or around the heart. They can be damage to the blood vessels or the nerves. There's a small risk of stroke, small risk of anesthesia, and a late complication can be damage to the esophagus or the food pipe that sits right behind the heart, which can sometimes get injured. Ablation can be fairly effective, about 70 to 80%. It's a relatively straightforward procedure and may help your AFib. Thank you. This is Dr. Mehta.